Welcome to the Lesson 3 of the Planetary Health Green Skill for Nurses course. In this lesson, our focus will be on planetary health education. This topic corresponds with core competency 2, especially the latter part of it, participation in the practical training of health personnel. In 2006, a report published by the World Health Organization estimated that about a quarter of the global disease burden and more than a third of the burden in children was attributable to modifiable environmental factors. Our societies face clear and potent dangers that require urgent and transformative actions to protect present and future generations. The present systems of governance and organization of human knowledge are inadequate to address the threats of planetary health. This endeavor will necessitate that societies address the drivers of environmental change by promoting sustainable and equitable patterns of consumption, reducing population growth, and harnessing the power of technology for change. Health professionals have an essential role in the achievement of the planetary health. Working across sectors to integrate policies that advance health and environmental sustainability, tackling health inequalities, reducing the environmental impact of health systems, and increasing the resilience of health systems and populations to environmental change. Much of the work in achieving planetary health will revolve around promotion and prevention, which is key in nursing and nursing education. However, to effectively carry out this promotion and prevention work, nurses must be educated and knowledgeable about planetary health. An increased focus on the interdependence of all life on Earth as application to health professionals across the world. This focus ensures a health workforce that is informed about the interdependence of ecosystems and health, prepared to tackle social and ecological injustice and inequalities, and possesses the skills, values, and capabilities to respond. The ENRF policy brief defines nursing planetary health as taking care of the health of human civilization together with the state of the natural systems on which it depends. Education for sustainable healthcare emphasizes ecological accountability through environmental stewardship, which means caretaking of the living planet by health professionals and healthcare education institutions. To achieve this, planetary health needs to be included in the education of nursing students as it is intertwined with every aspect of nursing sciences and can be integrated into existing programs or added as a new topic. Trained nurses can also learn about planetary health through self-study, staff training in healthcare institutions, or continuous professional education courses like this one. The AMEE consensus statement recommends changes to health professionals' education to integrate planetary health and sustainable healthcare education into nursing studies, giving a vision of creating a nursing workforce that can deliver sustainable healthcare and promote planetary health. Health professions education must equip undergraduates and those already qualified with the knowledge, skills, values, competence, and confidence they need to sustainably promote the health, human rights, and well-being of current and future generations, all while protecting the health of the planet. Education for sustainable healthcare includes mainstreaming planetary health as a transversal circular theme. You can find a link to the AMEE consensus statement in the additional resources. This figure shows you how values and knowledge learned in nursing education should guide nursing practice and skills. The planetary health knowledge and skills have a huge overlap with the knowledge and skills that nurses use in their everyday work and can contribute to more holistic and effective care. For example, promoting healthy lifestyles can have a huge impact on the health of a patient, and it is inherently connected to the planetary health. You will learn more about this in the next lecture. Planetary health should be included in existing nursing education subjects as well as practical training. National and global accreditation standards will need to take planetary health into account, and education institutions will have to start planning the required changes in education. Even if you are working with patients and not in nursing education directly, you can still support planetary health education. When there are nursing students in your team, encourage them to look at the patients through the planetary health lens and include sustainability in their practical teaching. Or you could, for example, organize a professional staff development training for your team on planetary health and what it means for your patients. Planetary health is inherently interdisciplinary. It requires collaboration between different types of healthcare professionals, for example, your colleagues, all your colleagues. Moreover, the knowledge and expertise of patients, decision makers, administrators, scientists, engineers, or architects, and others are valuable to be considered. Each of them can help you advance your understanding, and the interconnectedness of planetary health and their views and ideas can contribute to sustainable solutions in healthcare. We will go deeper into this topic of collaboration and using your voice as planetary health advocate to make wider societal changes possible in the lesson 9. Take a moment to reflect. Did you learn to take the wider picture into account during your training? How could this be improved? Discuss with your colleague how you can introduce nursing students in your field to planetary health.